Okay, awesome. So please feel free to ask questions or comment in the chat box on the conference platform. We do recommend using the conference platform chat only because that will be recorded in with our session. And please keep yourself muted unless the presenter asks otherwise. We are going to give 3 different separate presentations, and at the end, each take time to answer any questions that you may have. So first, I would like to go ahead and introduce Ms. Kathy Scheld. Kathy is the home visiting coordinator for My Family of Montgomery and Wilson counties. She's worked with young mothers and children for the past 8.5 years to ensure that they have receiving services and support in her area. She works closely with agencies to recruit and retain families for all programs. Next, we have Ms. Tiffany Green. She is the home visiting coordinator for My Family in Cherokee County. She's been working with families in Cherokee County for almost 11 years. She currently connects families that are expecting and have children through age 5 with home visiting programs, preschools, and resources in her area. And last but not least, we have Miss Anita. She is the Community Engagement Coordinator at Project Eagle and Connections. She's been with Project Eagle since August of 2018 and has enjoyed serving the greater KC area. In this capacity, she works on partnership engagement, community outreach, marketing, recruitment, and is one of the Wyandotte County IRIS community managers. Prior to relocating to the KC area, Anita worked for another nonprofit in the education sector. Anita is an Emporia, Kansas native and earned her MBA and BSB from Emporia State University. As a lifelong learner, Anita looks forward to continuing her education in the near future. Although her background is in business, she has spent the last 6 years working in the nonprofit world. Part of what drives her passion in this area of work is the help she received as a first-generation college student and her love of helping others. In her spare time, Anita enjoys volunteering for other local nonprofits. Anita is actively involved in several coalitions and communities in Wyandotte County and the surrounding area. She currently serves as the president for Wyandotte County Emergency Assistance Coalition. Her active participation includes also being a member of the Latino Health for All Coalition, Victims Advocate Network, WICO Community Resource Connection, Heartland Community Connection, Greater KC Coalition to End Homelessness, and KCK Livable Neighborhoods Program. Connections is a comprehensive early childhood intervention and screening referral system. Their focus is to connect families in Wyandotte County that are expecting or have children under the age of 5 with community resources that may be most beneficial to them. One of their goals is to improve the utilization of community resources and keep up to date with resource information. Thank you all so much for being here. I will actually go ahead and get us started today. We had a little bit of a mishap with the speaker, but that's okay. My name is Kayla Winfrey. I'm sure you probably have all seen me a few times now. I am a prevention specialist for DECA. I actually assist in implementing both local and statewide prevention initiatives. So that includes substance misuse and abuse education. I support early childhood projects, and I also provide consultation, technical, and training services to community partners. And it's actually really fun for me to have this job in this capacity because my background is in early childhood. I did some direct care work and taught preschool. And so it's kind of nice to have full circle and be able to support early childhood projects now. So with that, I'm going to go ahead and share my screen just to start talking a little bit about the work that I've been doing on early childhood projects in the state of Kansas. Okay. So the grant that I have been working on, we always talk a lot about, you'll hear PDG grant. And what that means that is in 2020, Kansas had the opportunity and the renewal of a federal grant funding to engage in a collaborative effort to shape the state's future direction for early childhood. This is a 3-year renewal grant that was authorized by the Every Student Succeeds Act and will support the implementation for the All In for Kansas Kids Strategic Plan for early childhood in Kansas. This funding will also support activities to update the statewide needs assessment and strategic plan to maximize parent and family knowledge of early care and education options. Also includes the sharing of best practices among the early childhood care and education workforce improvement of the overall quality and service integration of early childhood services, along with monitoring, evaluation, and data use. So this grant is housed in the Kansas Children's Cabinet, and that's who we partner with for our work. They also have bi-weekly webinars too, so you might also receive some emails from them at times. So the grant that I have specifically is called the Subgrant to Connect Family and Services. The goal of this grant is to enhance the infrastructure, increase collaboration and outreach, and also to develop awareness campaigns to help connect families to community services. So a lot of this work involves destigmatization of home visiting services, a lot of outreach and awareness. Something that I'm currently working on that I will share with you is kind of contacting local partners and just letting them know what home visiting is. So we have a cool couple of different materials that I will show you today that will help with this awareness campaign. But first, let's talk about what our campaign will be. So when thinking of a campaign, we had to come up with a few objectives. And our main objectives for the campaign that we've been working on to promote home visiting is to normalize and destigmatize home visits, to promote home visit services to new and expectant families of all backgrounds, and to grow the program so that every new mother receives a visit. And one of the biggest things that we hear is that a lot of home visits are stigmatized because of usually where they come from referral services or they're referred by DCF. And there's usually that shame marking on there that you need to have this or that there's something wrong. So those are objectives to overcome when looking at that is the stigma of asking for help is a sign of weakness or that you are doing something wrong. And then that fear of home visitors are only coming just to kind of be in your home and look out and kind of like that gotcha moment. So those are some things that we are trying to work against and really promote that home visiting is for everyone, no matter who you are, and that it can help any family. So to do this and to start a campaign, we partnership with Bajillion Marketing. And Bajillion Marketing took our information, they took the description of Kansas home visiting, and they kind of ran with it and created this whole campaign that you might have seen a couple of times now on social media and a couple of billboards across the state. So their campaign rationale is parents have questions, right? I think we can all agree that when you become a new parent, you're like, I have no idea what I'm doing. But the perk of a home visitor is they can come in and help you answer those questions. And so that was how they based it off of, is that the folks on our campaign team are all parents. And they really try to use that insight of when I found out that I was pregnant, or, what a man on our team shared, he was like, I was scared to death when I found out my wife was pregnant because I'm afraid to even hold a baby. And so they really try to use some of that insight to come up with their campaign. And it has been absolutely incredible to work with them. So, and you'll see our background here of the home visiting is a free voluntary program that involves meeting a trained family support professional at a time convenient for you and your family. We have used that for all of our social media platforms, all of our information on the Kansas home visiting website, just to really make that clear and have that message. And so that even if you have a short attention span or anything like that, we know that this is what a home visitor is, this is what they're going to do, and here's how you can connect with them. So through our partnership with Bajillion, their solution, as I said, is the Answers at Your Door campaign. And their thought process behind that is that you can get everything at your door nowadays, right? Because COVID world happened and you could deliver, a pack of diapers, a pack of food, anything that you would like. And so that was kind of the thought process behind that, is that in this world that we live in, you can have even a new car delivered at your door. And so during that transition to parenthood, you can really customize that service and have it be the same as anything else that you would order, essentially. Their key audience would be our women ages 18 to 45 who are pregnant or planning to become pregnant. We also have new parents and support networks too. We know that sometimes home visitors also can support families that have been transitioning to kinship or anything like that as well. So as I mentioned before, just a couple of our marketing strategies that we have done to build this campaign is we were able to purchase 11 billboards. We also had radio ads run across the state of Kansas as well. And so I have just a couple of the pictures of the billboards that we've had. We actually still have a couple of up too, which is the nice thing about buying billboards is unless they have something to replace it, it will stay up there. So I'm just getting free marketing right now, which is great. It's been like 6 months. I don't even think they know. So that's a bonus for us. And then you will see that I also created a Kansas home visiting social media page. So we have a Facebook and an Instagram account now. Those are new and super exciting. We've been able to build some traction there. And we learned that Facebook and Instagram are the most commonly used by parents and community members. And so those were our reasonings behind those platforms. We received a lot of questions through there, and I've been able to kind of help navigate how to get referrals, which has been super cool as well. In the middle here, we have our brochure, and this is the brochure that I will be handing out to community partners. And that brochure was created by Bajillion, using all of their messaging and the campaign rationale that they have created. And this brochure really will help us. I'm looking to get it into the hands of different doctors' offices, libraries, churches, anything like that that can really spread the word of Kansas home visiting. Great news, actually, when we looked back and had our digital report, we see an increase of 74% of website traffic because of our campaign initiatives and because of all the work that organic work that we've been doing behind the scenes. We've seen an increase, and this number has actually even gone up to 83% now. This number was from August, but I just looked at and peeked at our September data, and this number continues to increase of the traction that we are getting to our website, which is great because hopefully that will increase referrals for you all. And then our last piece of our campaign is promotional videos. And so we kind of went back and forth of what's the best way to really grab someone's attention, let them know what home visiting is about. And Bajillion came and approached us with this video concept. It's 3 different videos that they have. One will feature a pregnant woman, a new parent, and a third will feature 2 parents together. So the goal is to emotionally connect with those viewers and really target those specific categories by having a personal look into their experiences of a new parent. And we just received these. And so I'm going to show you all them today, and you'll be the first ones to see them. So that'll be really cool. We would love any feedback that you have on these videos. We worked really hard on them. They actually contacted specifically home visitors, and they were like, what do you wear? What do you say? Like trying to make it very much a real life experience so that it connects back to the work that you do and what the families will experience as well. So the first video that I will show you is going to be that video that is going to target someone who would just be finding out that they are pregnant. Let me make sure that I have my sound on with you all. And there we go.
With pregnancy, there's always something new to learn. You have questions? We have answers. Visit kshomevisiting.org to schedule a home visit today.
Okay. And our next video. Maybe the other one would stop playing. There we go. Okay, and then I next will show you our baby video.
Pregnancy, there's always something new to learn.
Apparently, I do not know how to work technology today. That is what is happening. Okay, let's try that again because my computer did a little bit of a freeze there. So let's see if we can fix that. No, I cannot. My Zoom is frozen, so I do apologize for any interruption, but I will have to hop on and hop back off. So Tiffany and Kathy, please feel free to go ahead and get started.
Kathy, I think you're muted. I'm going to go ahead and share my screen.
All right, and we have a little PowerPoint for you to follow along with. You're just going to kind of tell you what my family is and what we do here in Southeast Kansas. We're a centralized intake in Southeast Kansas. We connect families with programs and resources. We complete centralized intake for home visiting programs. We are funded through MIECHV, which is a federal grant, and we serve 5 counties in Southeast Kansas. They're Cherokee, Labette, Montgomery, Wilson, and Neosho counties. Next slide, Tiff. For some recruitment, we have done some baby showers. We host multiple baby showers a year. I know in Montgomery and Wilson County, we do 4 total, 2 in each county. We work with churches and community partners to provide education and resources to local expecting women, and with kiddos up to 3 months old. Due to COVID-19, we've all done different things. Right now, we've done drive-through and drive-to-you baby showers. Also, to help get our message out about what we do, we have a public service announcement. We work with our local radio stations. I think Tiffany's going to give you an example here.
Being a new parent is an amazing and often challenging experience. If you're pregnant or have a child under 5 and live in Cherokee County, Kansas, there's good news. My Family is a free resource, giving busy parents like you information, support, and encouragement needed to help your baby grow up to be happy and healthy. Sometimes just a little extra help makes a big difference. My Family. Find out more by calling 620-762-2301 or visit our Facebook page at My Family of Cherokee County.
And then also through Facebook, newspapers, and our local news coverage. There's other ways we do marketing. Our local reporters are always invited to our events. And I know here in Montgomery County, our local radio will put it on the community event calendars. So that's always some free advertising. And of course, we just go around to businesses and place flyers and stuff of events that we have going on. Some early childhood events that we do. We provide the families with resources, one of our main objectives to do. One way we do that is putting on local events for families to attend. We do early childhood drive-through events. Have been a safe way over the past year that families can get outside and receive resource bags with information about programs including WIC, mental health, immunizations, preschool, the Dolly Parton Imagination Library, and ways that they can sign up for the home visiting programs. We do a lot of these events through our partners. That way we can share the resources and the time. I think Tiffany's going to finish this out.
Yes, so I am trying to get to my next slide. I apologize. There we go. So coalitions have been something that have been really helpful for us to stay involved in our local community. So if you don't do a little bit of digging, you might not know what coalitions your community has. In my county, Cherokee County, we have a pretty active childhood coalition and health and wellness coalition. So it's just a great way to connect with other professionals in your area, other programs that serve and help families. So just to have that communication with them has been super helpful. And there may be some that you just don't know about. So asking around, asking different directors from different programs about coalitions, even if it sounds like it might not be early childhood focused, I've found that a lot of them revolve around helping families, and that's been super helpful to connect people with resources and programs. So our main goal for my family is to recruit families into home visiting programs. So we've really had to get creative in our areas. So Southeast Kansas has a lot of very rural areas, rural population. So we have done things as simple as putting door hangers at our local apartment buildings and housing complexes. So a great door hanger that I found was actually a pizza box topper. So I think I went to pizzaboxtoppers.com, and it's kind of like a large sticky note, and you can put all of your information on it, and then you can just stick those on doors. I actually went to my local Pizza Hut and they stuck them on boxes for me for an entire month. So just creative ways in small towns to get people aware of what resources we have. We also go to local food pantries. We provide them with information. We have them stuff their food baskets with program information. Connecting with churches for events is huge. So we do baby shower events, different things like that. And sometimes we host those at churches because that's a great way to build relationships with your local churches because a lot of families are going to run through those churches in one way or another. K-State Research and Extension. I don't know if all counties have one or what counties have K-State Research and Extension offices, but I know here in Southeast Kansas, our K-State Research and Extension offices are amazing. So you should check and see if you have one. They do a lot of programming to help support families and to help support all sorts of things. So connect with them. They've done an awesome job of letting us come in, provide information, and they've just been a great support for our activities. Connecting with local DCF, foster care, mental health, hospitals, all of those local offices, just dropping off your business card, emailing information sheets have been really helpful. Those are all just like us. Everybody is so busy, so it's so difficult for them to know all of the resources. So just making sure that they know that we're here and we're here to help, and just sending constant reminders like, here's my card, just in case you've lost it. I know I've lost cards all the time. And then staying connected with schools is also a really big one. There's preschool screenings, kindergarten roundup, enrollments. So just getting out there, emailing principals, emailing counselors, let them know that you're here to support and help families is just a great way to recruit. Our biggest recruitment source that we found in Southeast Kansas, at least through my family, is going to be, for most of us, is going to be WIC and our local health department. They see so many families and they see them regularly. So just building relationship with those nurses, swinging by the office, bringing them your card, bringing them a quick fact sheet has been super helpful. So our health departments, the nurses that work there have been, at least in Cherokee County, my #1 source of referrals and families. We have a diaper program. I started our diaper program in Cherokee County, at least probably 8 years ago. And me and a gal at the health department started it over Valentine's Day, and we called it Love on Local Babies. And we went to different churches and set up pack and plays and asked them in the month of February to drop off diapers. And we did that for several years, and that's how we got our diapers, is through the support of local churches, which was great. And then along the way, we've done some Blue Cross Blue Shield grants, some other programming has had funding, we've had some MIECHV funding. So funding has trickled in for diapers as well, but we started with nothing and a few pack and plays in churches, and it really got started well. So families can earn diapers by doing 4 things. So there's a huge list of things: attending home visits, attending your WIC appointment, attending those prenatal appointments. They get those 4 signatures, and then we get to give them a pack of diapers, which has been a really great resource and a really great way to build those relationships with families. Another thing is outreach with home visiting programs. So there's several home visiting programs in each of our counties. So working together and going to those events, connecting with families. The FACT events, the Family and Children Together events, were something that me and a lady at the health department actually created. So if you live in a rural community like we do, there's not a lot of programming going on. So you kind of just have to put stuff together, go to the park, and start trying to engage families that way. And then IRIS. So IRIS has been how we send and receive referrals in Southeast Kansas. It's a great way to close the loop with referrals, and it's just something that we've been a part of and found it super useful. So if you don't have IRIS in your community, I recommend you looking it up, because it's just been a great way to send referrals to programs to send them back, and just to know that that loop has been closed. So after that, I'll open it up to questions, and I'm going to put our contact information on here for a second and then stop sharing my screen, because I can't see anyone while my screen is being shared. So here's our contact information. If you don't get a chance to write it down, feel free to shoot something in the chat and I can get it to you. But if you have any questions, feel free to unmute now or post them in the chat. So you wanted to, I saw, oh, no, is there, yeah, so we've done that as well. We've put out some flyers for pregnant moms from different programs. That's great. I'm not sure what Bright Right is, but that's great. Oh, and Anita put that IRIS link in the chat, which I appreciate. So if you're interested in that. The pizza box toppers, I ordered them online. So my supervisor actually owns a Papa John's, and that's where I got the idea from. So there was a pizzaboxtoppers.com website, and I was like, I want to do pizza box toppers too. So I went to that website. I, popped our logo, a little bit of information on there, and they were really cheap. We got thousands of them for really cheap. So that was a fun way to recruit. And then Kathy, do you have anything on, it says, can you give me some detail on Motor Madness?
Yeah, we've done that in Wilson County for the last couple of years, and it's through our early childhood committee, which is made up the library, the health department, early Head Start, parents, teachers, healthy families, the art council. It's a really active early childhood committee. And what we do is we go outside at the Early Learning Center in Fredonia, and we just have all kinds of different outdoor activities. We have hula hoops, and we have the parachute, and it's very well attended. We were supposed to have it last month, but it rained. So, but yeah, we do that once a year in Wilson County. It's a lot of fun.
Then I saw a question, can you go over signatures of community programs to get diapers in more detail? I wish I had my trifold. Feel free if you want us to email that. Everyone's looks a little bit different in the county.
Right.
But it's basically a trifold that we made, and on the inside of the trifold, it has all of your different options that you want to put on there that would qualify for a signature. So some of those big ones are signing up for a home visiting program. There we go.
Ours is called Baby Booty Bucks.
Yeah, so they're all a little bit different. You get those 4 signatures. In my county, you can pick up diapers at the health department or call me and I can deliver them. Usually I deliver diapers once a week. But it's just a great way to provide that resource to families. But we can definitely send you our different trifolds if anyone's interested.
Yeah, I had asked that question. I am with Healthy Families. So my name's Katie. So we in Shawnee County, there is Diaper Depot with community action. So there is a diaper program, but I was thinking of, is there a way to use it to encourage involvement in the program and remaining committed and consistent with visits? And so maybe what are a few of those places that you would suggest, like WIC, maybe your nurse or doctor signing it, other places, because we enroll prenatally up until like 3 months. So if there was during that time frame, maybe some ideas for creating a program like that.
Yeah, that's great. And we do, so each time that they participate in a home visit with one of our programs, they sign it. So like for example, for our families, some of them in Healthy Families, sometimes in Early Head Start, they're seeing those families 4 times a month. So that means every month that family's going to earn a pack of diapers, which is great. So we're just encouraging them to keep up with those visits and then providing them with a resource that we know anybody with kids in diapers needs. So yeah, that's what we do. And then also those prenatal visits, the doctors can sign, which is great. Those WIC nurses can sign it. We even have mental health appointments that can sign it. I think all of our forms are a little bit different. We've chosen things a little bit differently, but even like things like taking care of yourself. So if you go to the dentist, you can get a signature.
That's great. Thank you.
Uh-huh.
All right. Thank you so much, Tiffany and Kathy. That was great. And thank you everyone for questions. I do apologize for my hiccup in there. Anita, if it's okay with you, I'm just going to quickly finish my presentation real quick, just because I really want to show y'all the videos that we created. Just have 2 more super quick, and then we will continue on. And then at the very end, we'll take some time to ask questions and just kind of have a conversation about the presentations. So let me go ahead. I'm going to share my screen again. I was afraid this might happen because me and technology don't get along. So I was prepared to show them a different screen here. Here we go. Okay. Should you all to see that? Okay.
That's another smile. Yeah, that's my giggle boy.
With babies, There's always something new to learn. You have questions? We have answers. Visit kshomevisiting.org to schedule a home visit today.
Okay, there's my super fun video there. And I will close it out so sound does not keep overlapping. But this is our last one for toddlers. So we'll have these 3 promotional videos and we are able to send them to you all too. If you'd like to release them on your personal pages, just let us know. But here is our last one.
With toddlers, there's always something new to learn. You have questions? We have answers. Visit kshomevisiting.org to schedule a home visit today.
Okay, awesome. Yeah, super quick little videos there to share. And we do also have the piece that I will say for the work that I have been doing for our PDG grant and to promote Kansas home visiting is releasing surveys. I know that we all love surveys so much. I'm just kidding. I know that we don't, but it's okay because it helps inform the work that we do. And so we have 2 surveys that we've been releasing. One's a parent survey where we have been asking parents just kind of what their experiences with home visiting. And then hopefully we were supposed to have a parent on today that was kind of able to share their experience with home visiting and what their personal perspective is. But she was not able to make us. And so I will look to see if maybe she can still share a tidbit of her experience with us and be able to share that with you all, just so we still have that piece, because that's important to hear from those that we do serve directly. So I will drop just a couple of surveys in the chat here in just a second. The chat that I'm going to share here will be, sorry, I was looking, unless Latoya is on, I haven't seen her. But Latoya, if you are on, please also feel free to jump in at any point that you would like to. The survey I'm going to drop in the chat here is going to be a survey specifically made for workers. It's for workers can share their experience with serving families and what their job looks like as an everyday basis and how it interacts with the system. The purpose of this survey is to get some feedback on how we can shape funding and programs and policies and things like that. Just to kind of get a personal take from those that are on the ground every day doing the work, so it can come back and help reflect some of the things that we do here in our grants. So it's not a requirement, just an optional survey, but I just figured while I have the opportunity to get some of y'all's voices, I would love to do that. And with that, that will be the end of my little spiel. And we will have Anita go ahead and start next. And then if we do have our parent hop on, I will let you all know.
Thanks, Kim. I'm going to start sharing my screen. Give me just a minute. Perfect. All right, my name is Anita Muniz-Grandpre. I work for the Connections program in Kansas City, Kansas. We serve all of Wyandotte County, and we have been serving our county since 2003. We are a coordinated intake program, and I'll talk a little bit more about what that means. I did want to post this slide in here. Here are myself and my coworkers. I am very blessed to have such a great team. I definitely agree that a dream team makes everything work. Everything from our program assistant to our community navigators, the engagement coordinator, and then my boss, Leslie Warland, who's our assistant director of health and screening. Just giving them a little shout out. We're a comprehensive screening and referral program. And so what that means is we do a one-time visit with families, either their home or office or another public location. The visit will typically last about 1.5 to 2 hours. We're supporting the family by not only sharing information about community resources, but also serving them and doing referrals outgoing to early intervention and home visiting programs. Our eligibility for the Connections program is pretty basic in that as long as the family is living in Wyandotte County lines, has a child under the age of 5, or is expecting a child, then we can see that family. There are 3 basic steps in which a family would get connected to our program. The first is the call or the sign up. The second is the visit. And the third is the follow-up phone call. So during that initial call, that's when a family has an interest in our program, whether that be they have mentioned it through one of our partners and then our direct referral is sent on that family's behalf. Maybe they see it as a different community event or a meeting and they're signing up themselves, or maybe even a friend has told them about the program and they're calling us, letting us know that they're interested. Two is the visit. So once the family has called, we do a quick triage with them. Then we schedule them the following week with one of our community navigators. So my coworkers, the community navigators, are visiting the family. We give the family the option of meeting in the home, our office, or another public location. And as I mentioned earlier, it'll typically last an hour and a half to 2 hours. During that visit, our community navigators are really good about understanding what the needs and the wants of the families are. We will never give the family a big book of resources and say, here you go, good luck. This is all that we know for Wyandotte County. We really tailor the connections visits to what the family is looking for. So maybe mom called in because she's wanting more information about baby supplies and food pantries within her area. And then during our visit, the community navigators are picking up on some of those other things, like maybe mom also mentioned she wants to go back to school and get her GED. Maybe she doesn't feel safe at home with her partner. So not only are we performing screenings on the caregivers in the home, and that includes domestic violence, substance abuse, trauma, parent and child interaction, but we're also performing screenings on any child under the age of 5 in the home. And that includes hearing, vision, the ages and stages questionnaire. We're making sure that we're checking for any developmental delays or concerns that the parent may have for their child. We do let the family define caregiver, however that is in their home. So it could be biological mom and dad, it could be a grandparent, an aunt and uncle, or even a foster parent. That's not going to be a barrier when it comes to having a connections visit. So after that visit has occurred, the community navigator makes referrals on the family's behalf. They're sharing information about resources. And about 3 weeks after that initial contact, the family is given a follow-up phone call. The same community navigator that saw the family calls the family and says, hey, how's it going? I know that we made that referral to WIC. Were you able to get into an appointment or did they contact you? And that way at any given time, if the family has additional questions or barriers, they can call our community navigators on their work cell and say, hey, things have changed. Do you have information on this? And our community navigators can give them additional information. We can work through some of those barriers. Maybe mom didn't make it to the WIC appointment because she didn't have transportation, or she just wasn't able to make it that day. She was sick, and we talk about health insurance. So whatever the case may be. A large part of what we do, or the main part of what we do, is our referrals into our home visiting partners in Wyandotte County and also early intervention programs. I love this picture because it's a great representation of all of our programs or home visiting programs in Wyandotte County. We work very closely with Children's Mercy Ties, Kansas Children's Service League's Healthy Families. There are 4 Parents as Teachers programs in Wyandotte County, 1 for our Turner School District, 1 for our District 500, 1 for Piper, and 1 for Bonner Springs. Our Wyandotte County Health Department also has a Healthy Families program. And then Project Eagle, the organization that I work with, has a home visiting program called Early Head Start. All very similar in how they serve a family, but obviously we all know here, very different in the eligibility for those families coming in. And then of course, any referrals to infant toddler services. The main part of my presentation today is going to be talking about our work that we've done around marketing and recruitment. And so I think in the title I had put that we have 3 Ps of outreach: promotion, persistence, and partnership. I don't know if there are any Office fans out here, but I'm a very big fan of The Office. So you'll find a couple of memes on here and a couple of GIFs. So the first P is promotion. This is marketing and advertisement. We've been working really hard the last couple of months since we've returned back to the office and figuring out in this new world what marketing, promotion, and advertisement looks like. So starting from scratch, a lot of people, a lot of contacts that we had at different organizations have left during the pandemic. So we started from scratch by finding out who the new contacts were, still being very involved in our community. So attending different community meetings, agency and staff meetings. We spent a lot of time prior to the pandemic, attending different events in our community, which unfortunately were put to a halt. And we're still finding that people are uncomfortable. It's still not a great time to host in-person events. So we came up with the idea of hosting virtual events specifically for our program called Coffee and Conversation with Connections, kind of a mouthful. And just opening it up that invitation to all community members who would like to learn more about our program and having conversations about how we can partner with them and just basic information about our agency. We did flyer drop-offs, so public spaces like libraries, clinics, offices, any of our nonprofit partners in our area. And then we always advocate for a program. So whether that's just telling a friend or if you're sitting at another meeting, just mentioning your program, and then just a couple of memes down there from the office. This is one example of our advertising that we've done in the last couple of months. This actually gets posted this week, so we're really excited. We have 2 billboards going up in downtown Kansas City, Kansas, that talks about connections. And then I'm actually going to switch screens just for a minute out of my presentation because there is a video I do want to show. Give me just a second. Oops.
Hey, Anita, we're not seeing what you're talking about.
Yeah, I don't have it pulled up. It's actually, give me just a minute.
I don't know if you showed the billboard, but we couldn't see that either.
Oh, on the PowerPoint?
Yeah.
Okay, give me just a minute. Oh, it's going to kick me off. Sorry, I'm having technical difficulties. All right, can you hear me?
Yes.
Okay, but you can't see anything on my screen.
No.
All right, Kale or Kathy or Tiffany, if somebody wants to take over, my screen is completely frozen in black. I don't even see the Zoom right now. I don't know what's going on. Give me just.
I seen her slideshow earlier and it was amazing.
Okay, sorry. Give me just a second. I'm going to try to figure this out.
Kitty, I had a question for you, if you don't mind answering.
Me, Katie?
No, Kaylee. Maybe she's down too. Tiffany, maybe you need to do a song and dance.
Scare everybody off. Does anyone have any other questions or comments while we're waiting about things that you guys are doing in your communities that have been really helpful for recruiting and retaining families?
I'm going to steal an idea that our local parent as teachers did last December. They had a drive to Santa where families drove through. They got a book and they had little containers so the family could make cookies at home. They had the cookies and that way they could decorate them. So maybe with some of the holidays coming up, you can do things like that. But it was really well attended. It was cold, but I thought it was a cool idea.
I saw a question in the chat. How do you verify signatures for the diaper program? So again, each of our counties kind of do it a little bit differently. And for me, it's the honor system.
Yeah, us too.
So that if we run on donations and it's first come, first serve, we've been blessed not to have, we've had so many diapers and so it's been wonderful. So we haven't had that concern that people aren't going to get them. So our communities really stepped up and supported it. So I think you just have to decide that within your own community, but typically it's just the honor system. And I haven't really had any problems with it.
Yeah, us too. Just do the honor system.
Kale, you had mentioned the kansashomevisitors.org and I went on there and our information for our home visiting is not correct. So who do we contact to fix that stuff?
I was on mute. Yeah, thank you for looking at that. If you want to send me a message, I will drop my email actually here in the chat. And Lydia is the one who runs our website, and so I will let her know to go and make those edits. Sorry about that. And that goes for anyone. If you have any feedback or something that needs to be changed, just let us know, and we are more than happy to go and make those edits. Sometimes it's hard because we get third-party information, so more than happy to update that.
And when you talked about your website, when you do the videos and stuff, so if you get somebody who contacts you and it's a family in Wilson County, how does that information get back down to us?
Yeah, that's a great question. So typically what we'll do is always refer them back to the website, because when you, and what we let them know is that when you go on the website, you're able to hit that find a home visitor link. And you can type in your zip code, or you can look on the map there where you are, and it will take you to all of the programs that's in your county. So I will.
Hi, I'm back. I'm so sorry.
No, it's, hey, I've also been there too. I'm glad. I don't.
I've never had that happen. It just, everything was playing and I couldn't see anything. My computer went black and it kicked me off. So, but I'm here.
Okay, glad you're back.
Okay, perfect. Let me see. I'm on my desktop, so I don't have a video, but I can definitely still show my screen. Okay, can we see the photos now? All right, I was told we couldn't see the billboard before. All right, this is the billboard that will be going up in downtown Kansas City, Kansas, 2 different locations. That actually goes up this week, and we're really excited for that. And I wanted to show, we have one other advertisement that started last week through AMC Theaters, and it actually started airing last Monday and will play until the beginning of November. I'm going to try to switch screens and hopefully show that, and I hope it doesn't mess up. Give me just a minute. Okay. Technology, please work for me today. All right, do we see the screen? Okay, perfect. And then let me know if you hear it.
You want the best for your family, and we're here to help. Connections can help you find answers to important questions and connect you with valuable community resources. Let us help. Call Connections today at 913-321-9999.
Awesome. So that's our other one. Just really exciting, big advertisements that we haven't really done before, that we've done in the last couple of months. I'm going to switch my screens back. The other P of the 3 Ps of home visiting outreach is persistence. So we talk about our who, our when, our why, our where, and our how. So for our who are those partners who are going to be involved? Who at that organization do you need to talk to? A lot of times with persistence, it's reaching out to an organization you might not hear anything back from. You might reach out to one person, you don't hear from them. So it's reaching out to another person at the organization and just really finding that right person in order to make that partnership happen. The second is when. So when are you reaching out? Are you reaching out during a time that is really busy for them? So sometimes when we've reached out to grow a partnership with an organization, I've often gotten the response, hey, I would love to. Right now is not a really good time. We're in the middle of grant writing season. Reach out again in 3 to 4 months. Your why. So why are you reaching out? Is this beneficial for the families that you serve in your area? Is it beneficial for that organization? Is it only beneficial to your organization? Giving them your why and why you would like to build a partnership with them. Your where. Are you going to be doing outreach on site? Are you going to be doing direct recruitment? Are you going to be doing it at their location, at your location, and how those logistics would work? And then your how, also part of logistics. Is it going to be in person? Because of the pandemic, we've had to switch to a lot of virtual formats. So is it going to be over Zoom? How are you going to have those families participate in those conversations, or the staff members that you're trying to reach out to? The third P is partnership. So as I mentioned in the previous slide, talking about logistics, your duration of partnership. So is this something that is continuous and ongoing? Is this where we're only going to have this partnership for the year, and that's just, we're going to figure it out and see how it goes? Is it a formal or an informal partnership? So is it just something that's really casual, or is it something more formal where you will need an MOU? The communication that you use and language that you use, not only with the families that will be targeted, but also with the staff members. What kind of language are you going to use with them? Or is it a medical center that you're talking to? Is it a nonprofit? And understanding their lingo and hopefully meeting them where they're at. And then finally, sealing the deal for partnership. What does that partnership look like? When does it start? And how can we get started? One and final P that I didn't include on my original presentation is the party and pat yourself on the back. So making sure that you celebrate your accomplishments, whether they're small or big. We've had 2 really big advertisements that shut off late, this month, and we're really excited for them. We've had a couple of other partnerships that started to take off. So recently we have been working with one of our local medical centers. It is a medical center that we have been trying to reach out to for years, where maybe we had a small partnership with them before, and then a person that we had contact with left. And so there was turnover and we didn't have somebody in that position for a while. So we've recently taken off with them and figuring out what our partnership looks like with one of the doctors, the OBGYNs. And we're hoping to also get included on their labor and delivery floor to also do additional marketing and recruitment for families. Okay, aside from the little technical difficulties, what questions do you all have for me?
Anita, it looks like someone had asked in the chat if you could show, I don't know if that was, must have been recent, if you can show the billboard again.
Yes, of course. All right, here's the billboard.
All right, awesome. Looks like too, I also had a couple emails come through and comments here about the Kansas Home Visiting website, which is so great. Thank you so much. I would definitely get this over to my colleague, Lydia. She's a wizard at all things tech and website. So we will make sure to make those edits. Does anyone have any more questions for Anita? We can open up to questions for everyone. Whichever feedback you'd like to give is welcome. Okay. All right. Well, if we don't have any more questions, that will conclude our presentation for today. Again, please feel free to send any and all feedback regarding the home visiting videos to my email or in the chat there. That is the first time that I have shown them to anyone, which is super exciting because we are really glad that they are done. And if you have any more feedback or need edits changed on the website, also please feel free to let us know. Thank you so much, Tiffany, Kathy, and Anita, for being here today and for sharing more about your programs and all the great work you do to recruit families. If that will be it, I hope you all enjoy your break and we will see you at our next session.